What a gorgeous day. Look at Rusty. He's so happy about this.
He loves haircuts.
Hey guys. Yep, you are riding in the Jeep.
So a lot of breeds, you're not supposed to shave them because they can actually remain more cool if they have all their hair.
Uh-huh.
We asked our vet out in South Carolina about Rusty and she said it's okay to shave him.
He loves being shaved. You can, like, as soon as he's shaved, he runs around. I shouldn't say runs. He prances like the happiest boy. I think we should have a little chat about doctors, privacy, children on YouTube. What do you think?
Yeah, definitely. Today's the perfect day to have it.
Yep.
This is our live update for today's episode.
Given the topic of today's video, would you be cool with pausing the shaving and going where the sun isn't so bright?
Well, it's gonna be hard to get Rusty back.
Oh, that's better.
You know, I think... I think it's important to note that, why did we start our channel?
Because it helped us so much when we were going through IVF to have other families to look for hope, I guess, and
even learning about the process.
Right.
So we came across
Ellie and Jared was the
Ellie and
first.
Jared, but really Matt and Dory's Excellent Adventure podcast.
We binge listened to it, and then they have a Facebook group also. When we found out we were going to be going through IVF, and it made the whole process seem a lot less foreign and a lot less scary, I guess.
Right, and so watching Ellie and Jared is like what inspired us to start our own vlog. And listening to their story.
Seeing their kids.
Yes, seeing their kids.
Like their lives every day with kids. That was like so inspiring to me to know that they had been through kind of the same struggles we had.
Exactly. And I think especially Matt and Dory, because they talked about their medical problems and, talked about medications and all the side effects and all that stuff. And so that just, really opened our eyes to like, it's okay to be vulnerable and to share, kind of private information like this.
Mm-hmm.
So thank you, guys.
Right. Yeah, there's a spectrum of how open you feel to sharing like the deepest, most private parts of your life. And I feel like neither of us are embarrassed by really anything. And so because we're so open about everything and we're open to share, we feel like we can put all of this out there in the hopes that people can learn from it and feel like they're not alone. And that's sort of what our channel has evolved into, and it's changed from infertility to parenting struggles, sometimes relationship struggles, and now dealing with a surgery in an infant, which is terrifying. Exactly.
And so that's why today's footage, you'll see all the information that the doctor is telling us about Eloise's kidney. Not like that's like a super private or definitely not it's definitely not an embarrassing subject or anything. But a lot of people probably wouldn't feel comfortable putting the information that we're putting out today in our video out to the public.
And that's okay. Like, not everybody's the same. You'll even see, or you've probably seen in the past vlogs, that Brad and I are processing this and handling this information completely differently. And that's okay. There's not one of us that's right and one of us that's wrong, and I think that's important to remember. We just process things completely differently. There's no doubt that Brad sees things more on the bright side, and I seem to play devil's advocate a little bit more, but that just balances us out, and we don't have to agree with how we process this information. I don't need to conform to his side, and he doesn't need to conform to my side. There is no right and wrong. However you process, if your baby has to undergo surgery, however you have to process that is how you have to process it. There's no right or wrong way to do that.
Exactly. So huge thank you to our doctor, huge thank you to the Women's and Children's Hospital of Columbia. You guys just did a great job.
You're amazing. Yeah, it was, even while we were sitting in the waiting room with Eloise, or while she was in surgery, somebody that watches our YouTube channel came to check on us.
Yeah, one of the nurses, yeah.
That was really cool.
There was.
It just like reminded me of, I mean, we love our kids so much, and being able to show them off, so to speak, or like allow other people to get the enjoyment that we get brings us so much joy. So it just reminded us of the greater community that we have watching our kids and the village we have helping us raise them, honestly.
Exactly. All right, so enjoy today's Eloise update. Getting set up with Zoom for our doctor visit.
Eloise likes sitting at the table.
Yes, she does. This is our first Zoom meeting that hasn't been a cocktail hour, so we joked that we were going to grab a bottle of wine.
You should. Might make my day just watching you drink, you know. I'll also sip on my water here.
Yeah.
Make me feel better.
It's still a little early for us.
That's funny. You guys are like living the dream, man.
Yeah, it's not bad.
Seriously.
My friends did, like we did I think it's called House Party, the app.
Oh,
And they have games. You know?
cool.
Yeah, we'll definitely have to do that.
And this is like geography and like ridiculous questions.
Oh, okay.
Okay, so share screen. So this, where my marker is, this is the ultrasound from January, okay?
Okay.
This circle in the middle is the bladder. This is the giant sausage left ureter coming in and going all the way back behind the bladder to somewhere bladder neck, okay?
Okay.
And I'm gonna find the bladder on this. This is the bladder on this recent ultrasound you guys did. And there's no dilation behind it. So there's no more ectopic ureter going anywhere.
Yeah.
So
Wow.
Good.
then as you scroll up, there's no dilation even in the middle of the ureter for you to think that where we made the connection is abnormal. You can't even see it. So there's no stasis.
Awesome.
Right? Then as you go up into the kidney, okay, so this is perfect. So this is before surgery. This is the upper part of the left kidney. And this is the lower part having grade 2 dilation because of the pressure from the upper part now draining very good. All right?
Okay.
And when you look here, this is now, compared to this is now the lower part, the upper part. And the lower part doesn't have any significant dilation anymore.
Awesome.
Okay.
So over time, that stretched skin, is my analogy, gets better. She may still have a little cystic dilation there because I didn't go up into the kidney to cut out that wall, right? I just made it better. And so we usually say decompressed hydronephrosis because we know distally there's nothing, the connection is fine and everything is pouring through.
Wow.
Awesome. That's great.
Makes sense? And the connection hasn't disrupted the lower part drainage. The lower part drainage has actually been improved by this cystic mass pushing on it.
Yeah, makes sense.
That's it.
Good.
So the upper pole or the upper portion of the
You're
kidney.
gonna wake up,
Yeah.
hopefully someday.
Okay.
It's draining, and so she never, after potty training, she should not, I'm trying to find it. After potty training, she should not have any urine dribbling, like always wet. Usually that's the story for ectopic ureters. So she wouldn't have that. And we know there's, like a semblance of a little function in that. So we're hoping that this surgery will preserve whatever is there and continue to grow with her. But at least the rest of the kidney is not being bothered by this mass.
Gotcha.
Cool.
Very cool.
And you don't think that makes her any more susceptible to infections or anything like that?
No, because now it's no longer a pond. It's not a river. It's running through. But the stretched skin has to fill a little bit before then it pushes it out.
Okay.
Because there's space now, right?
So as far as how the kidney's functioning, will we do another follow-up to determine the function of the kidney, or do you expect it'll stay the same? Okay.
No. Usually we just follow with ultrasounds.
Okay.
Now if we had worked by the kidney, like if I'd gone to cut out the whole upper pole, sometimes we do that if we think there's not much function in there. If I'd gone to do that, then we have to do that study a few months later to make sure that I didn't knock out the function in the lower part.
Gotcha.
But since we didn't do any upper tract surgery, it's safe to watch them with ultrasound. Now, over time, if it's just you just want to know, yes, 2-3 years later, we should repeat a baseline. I usually just ultrasound to see how everything shrivels up instead of getting dilated. Because if it starts to get dilated or the lower part starts to get dilated massively, then we get worried.
Got it.
Hello.
Hello. You want to sit up here?
She's so pretty.
Thank you.
Where's your little scar? Look at this
You
outfit.
want to
Scar.
see?
I think mommy to take me shopping.
This was her grandma.
Oh, that's awesome.
Yeah, it looks really good.
It looks great.
Yeah, it will lighten up. Like right now, it's still kind of red. You can see it. It'll be obvious, but over time, it won't be.
Good.
So.
Yeah, her scar looks better than my C-section scar. That's for sure.
Our goal was to still make her a model and a surgeon. So
Yeah.
that being so obvious.
Would you mind fixing my scar?
I wouldn't, mommy. Let's chat over a glass of wine. Let's plan the selfie with a glass of wine.
Perfect.
Okay, any questions?
When's our next follow-up?
Oh, 6 to 9 months.
Okay.
Cool.
So usually eventually it becomes just 1 year follow-ups, you know, mainly making sure the lower part doesn't get dilated and the other one doesn't get bad, because we hope that it will shrink as she's growing. It will look smaller and smaller over time. But again, it's the same analogy. If something is stretched out and the skin is so thin out, even though it's decompressed hydronephrosis, you may never look totally like, I mean, even if you lose so much weight, you still sometimes have a little bit of stretched skin. So
Right.
that's it.
All right.
Okay.
All done.
Say bye-bye.
Okay,
Bye.
thank you for your time.
Thank
Thank
you.
you.
Okay, take care, guys.
You
Bye.
too.
Bye.
That's a relief.
I just want to say, I just knew it all along.
I know you did.
That's great.
Oh, that's so good.
That's really good.
So what I saw was
Maybe
stretched
you were looking
out.
at, yeah, or I was
I
gonna
know
say,
it.
maybe you were looking at the bladder too.
No, because I know the bladder she did separately. Like
Okay.
she did the kidney and then she went down to the bladder. So I was just looking at that upper pole that was still really dilated.
Yeah.
But, and it looked a little bit smaller than initially. Like you can see in the recording that we did of the side-by-side ultrasounds. The upper pole of the kidney is still pretty dilated, but
definitely.
turns out that wasn't, like that going away completely wasn't the goal.
Right.
It was to get rid of that,
Makes sense.
the dilated ureter, I guess, which was gone.
Yeah.
And part of the risk of doing this was that it could have put pressure on the existing ureter and made that one dilated and ended up making the whole thing worse, but that didn't happen. So,
great news all around.
best case scenario.
Yay!
Yay! I need a glass of wine.